So ACEs stands for Adverse Childhood Experiences, and those are potentially traumatic events that happen for a child before their 18th birthday. That can be things like experiencing intimate partner violence in the home or domestic violence, you might know that term. Could be dealing with a parent who has a mental illness issue, depression, or some other mental illness, physical or emotional abuse or neglect. Even witnessing community violence, and those things can really impact children's developing brain and then have lifelong impacts as well.
What that really means is that bad things can happen in the life of a child. What we've learned about ACEs is that they're common. More than half of us have them.
It's not new information that, if bad things happen when you're young, they could, affect you later on. But it comes from, in the mid-90s, there was a study. What the study found is about 60%, or if you think like 6 out of 10 folks that have experienced at least one ACE. And here in North Carolina, it's about 1 in 4 children.
On a child, the effects are much bigger because the child's brain is growing and developing, and those stressors actually change the way that the brain is built. The more ACEs you have, the greater the chances that you can have a lot of really serious illnesses like cancer or depression.
When we think about the public health impact, if we can think about our society's biggest issues that we're trying to solve, when we think about incarceration rates, when we think about the juvenile justice system, or even the issues that we're having with some of our children in the education system, over 85% of the children that end up in juvenile justice have experience with ACEs. It impacts, homelessness rates. It impacts our substance use issues. We have the, opioid crisis we're, contending with, or any other substance misuse issues.
There are many things that can happen in the life of a child that are hard for kids to deal with. So when things do happen, there are ways to heal. SAFEchild does so many things. One of the things they do is getting the message out, because all parents need support.
We need folks to realize that help is available and that it's here and that we are here for you.
Trauma can heal, and it can heal at any age. And there are so many ways to heal.
Parents who may not have had the chance to deal with some of their own childhood traumatic experiences have the opportunity at SAFEchild to mitigate those effects that they might have on their children through those preventative parenting programs and support groups.
They have supports for parents that have had mood disorders. They have supports for parents that just want some skills, because it's a lot easier to be patient with a 2-year-old when you know what is appropriate behavior and expectations of a 2-year-old. So sending that message of support to all parents is really important.
In addition to our programs, SAFEchild has taken on and become a community leader in convening different organizations and partners from multiple sectors to the table to say, okay, what does it look like for us to address this in the community? What does it look like for us to think with one another, share information so that we're no longer working in silos. Mental health information that was just, may have been reserved for those in the mental health field, we can share that information with educators. So working across, our divides to be able to share information and problem solve collectively. And for organizations who are looking for guidance, we're happy to let you know what other organizations have done so that if you're looking to implement trauma-informed care or other best practices around resilience and responding to individuals who may have had trauma, we can connect you with partners in that way as well.
None of us is an island. We all need other people. Getting that message out prevents child abuse. And child abuse is a terrible ACE. The more we help parents not only know what they should do, but help them gain that skill set and that confidence so that they know how to handle things and they believe in themselves, all of that is incredibly helpful. And all of us can play a part in that.